Assalamu alaikum students. Today we will start with the reproductive cycle. Uh, so how a reproductive cycle is defined? This is a series of events occurring regularly in females every 26 to 30 days throughout the childbearing period between menarche and menopause. Actually, the reproductive cycle, it consists of a series of changes taking place concurrently in the ovaries and the uterine lining, stimulated by the changes in blood concentrations of hormones. And the hormones secreted during the cycle, they are regulated by negative feedback mechanism. Now, I am going to give you an overview of the reproductive cycle. Hypothalamus secretes luteinizing hormone releasing hormone, which stimulates the anterior pituitary to secrete FSH and LH. FSH here stands for the follicle stimulating hormone, and LH is the luteinizing hormone. So what happens that the hypothalamus, it secretes LHRH, which stimulate the anterior pituitary to secrete the FSH and LH. Hypothalamus responds to the changes in the blood levels of estrogen and progesterone, and it is stimulated by high levels of estrogen alone, as it happens in the first half of the cycle. But the hypothalamus, that is expressed by estrogen and progesterone together, as it happens in the second half of the cycle. So, what is this? The monthly ovarian cycle, which is less accurately called menstrual cycle. And this rhythm is basically a function of gonadotropic hormones. Well, the ovarian cycle, it corresponds to physical changes in ovaries and other sexual organs. On average, its duration is 28 days, in which the gonadotropic hormones, they cause 8 to 12 follicles to begin to grow in ovaries, while an abnormal cycle length that is frequently associated with decreased fertility. Let's see the effect of gonadotropins on ovaries, which is the follicular development in the ovaries. The reproduction that begins with the formation of ova in the ovaries. Every month, a single ovum is expelled from the ovarian follicle, which passes through the fallopian tubes into the uterus. If fertilization occurs, it is implanted in the uterus where it develops into fetus. Otherwise, it undergoes degeneration. Well, you see here that about every 28 days, the gonadotropic hormones, they cause 8 to 12 new follicles to begin to grow in ovaries. And during the growth, estrogen is secreted, and one of the follicles they become mature and ovulates. After ovulation, corpus luteum is formed by the secretory cells of ovulating follicle. And now this corpus luteum it secretes progesterone and estrogen for 2 weeks, and then it degenerates. And then menstruation begins upon this degeneration, and a new cycle follows. Right. So, on the basis of this knowledge, how would you define the ovarian cycle? You see, the ovarian cycle is the normal cycle that includes the development of an ovarian follicle, rupture of the follicle, release of the ovum, and the formation and regression of the corpus luteum. And here you can see the phases of the ovarian cycle. The first phase, that is a follicular phase, and the second one, that is a luteal phase. Well, the follicular phase, or you can call it follicular phase, that's the phase of the ovarian cycle which is dominated by the presence of maturing follicles. And it shows the progressive stages of the follicular growth in ovaries. Now, what happens in the follicular phase, that a cohort mean the group, a group of the follicles, they begin to develop, and the others lacking the hormonal support, they undergo atresia. During this phase, the primary oocyte, that is synthesizing and storing the material for future use. Well, here let me explain that when a female child is born, each ovum is surrounded by a thin layer of these cells, which are called the granulosa cells. The ovum with this granulosa cell layer, that is known as primordial follicle. At puberty, pulsatile release of the GnRH, the gonadotropin releasing hormone, that causes the release of the FSH and LH, under the effect of which some ovarian follicles, they start to grow. Then the ovum increases twofold to threefold in the diameter, followed by an additional layer of the granulosa cells, and now it is called a primary follicle. So, the follicular phase, that will include the proliferation of the granulosa cells and the formation of the zona pellucida. And the next step will be proliferation of the thecal cells and the estrogen secretion. Then comes the formation of antrum and the formation of a mature follicle, and finally the ovulation. Now, let me give you a little detail of each step. So, my dear, the first step, that is the proliferation of the granulosa layer and the formation of zona pellucida. You see, a single layer of the granulosa cells proliferate to form several layers that surround the oocyte, and they separate it from the surrounding cells. Now, this inner membrane, this inner limiting membrane, that is known as zona pellucida. The second step, that is proliferation of thecal cells and estrogen secretion. So what happens that as the oocyte enlarges and the granulosa cells, they proliferate, the ovarian connective tissue cells in contact with the granulosa cells, they also proliferate, and they differentiate to form an outer layer of thecal cells. These thecal cells and the granulosa cells, they are collectively called follicular cells, and they function as a unit to secrete estrogen. Well, the third step, that is a formation of antrum, which is the fluid-filled cavity that forms in a developing ovarian follicle. This stage is characterized by the formation of a fluid-filled cavity in the middle of the granulosa cells, and the follicular fluid, it originates from two sources. Number one, by the transudation of the plasma through the capillary pores, and then partially from the follicular cell secretion. Keep in mind that at the time of the antrum formation, the oocyte has reached its maximum size, and this is the period of rapid follicular growth. Right. So now, how a mature follicle is formed? One of the follicle grows rapidly than the others, and it develops into mature follicle within 14 days after the onset of follicular development. The antrum occupies most of the space in mature follicle. The oocyte, surrounded by zona pellucida and a single layer of granulosa cells that is displaced asymmetrically at one side of the growing follicle. Now, here, this process of ovulation, this is of prime importance, and this could be a university question as well. So, what is ovulation? It's the release of a mature ovum from a mature ovarian follicle. The rupture of follicular cells to release the ovum, that is facilitated by the enzymes released from follicular cells that digest the connective tissue in the wall. The ovum then is swept out of the follicular cells by the antral fluid into the abdominal cavity, and the released ovum that is quickly withdrawn into the oviduct where the fertilization may or may not take place. What you need to focus on is that a necessary factor for ovulation is a surge of luteinizing hormone. The luteinizing hormone, or LH, that is necessary for final follicular growth and ovulation. And without this hormone, even when the large quantities of FSH are available, the follicle it will not progress to the stage of ovulation. You also need to know the mechanism which is responsible for this LH surge, the luteinizing hormone surge. So, what happens that about 2 days before the ovulation, the rate of the LH secretion increases markedly, rising 6 to 10 fold and peaking about 16 hours before ovulation. There are two causes of this LH surge. First is the positive feedback effect of estrogen on the luteinizing hormone, and to a lesser extent, the FSH excretion. Now, this effect that is in sharp contrast to the normal negative feedback effect of estrogen during the remainder of the cycle. So keep in mind that the first cause is the positive feedback of the estrogen. Well, the Other cause of the LH surge is the increasing quantities of progesterone from the granulosa cells a day or so before the LH surge, and this could possibly stimulate the excess LH secretion. So, how to assess if the ovulation has occurred? It is by the urine analysis in the later half of the cycle for the measurement of a surge in pregnanidiol, which is the end product of progesterone metabolism, and a lack of this substance that indicates ovulation failure. And then we can also do the confirmation by charting of body temperature throughout the cycle, because the secretion of progesterone during later half, it raises the body temperature about half a degree Fahrenheit. Let's now move on to the luteal phase of the ovarian cycle. This phase of the ovarian cycle dominated by the presence of corpus luteum. The ruptured follicle which is left behind, it changes rapidly, and the thecal and granulosa cells left behind, they collapse into the emptied antrum that has been partially filled up with the blood vessels. Well, the luteal phase, that includes the formation of the corpus luteum and the secretion of progesterone and estrogen, and it also includes the degeneration of the corpus luteum. Let's start with the formation of corpus luteum. You see, corpus, that means body, and luteum means yellow. So it is an ovarian structure that develops from a ruptured follicle following the ovulation. The follicular cells, they are transformed into the corpus luteum, um, and the follicular turned luteal cells, they are converted into very active steroidogenic tissue. The abundant presence of cholesterol, steroid precursor molecule, and the lipid droplets within the corpus luteum, it gives it a yellowish appearance. The progesterone secretion, which is followed by the secretion of estrogen in the follicular phase, that makes the uterus a suitable site for the implantation of the fertilized ovum. So, should I ask you now that what are the results of the female sexual cycle? So, the results, they are twofold. You see, firstly, only a single ovum that is normally released from the ovaries each month. So, only a single fetus that will begin to grow at a time. And um, then there is another result, that the uterine endometrium, that is prepared in advance for the implantation of the fertilized ovum at the required time of month. All right. Next is the degeneration of the corpus luteum. You see, if the released ovum that is not fertilized, the corpus luteum degenerates within 14 days after its formation. And the luteal cells, they degenerate and they are phagocytized. While the blood supply is withdrawn and the connective tissue, it fills in to form a fibrous tissue mass which is known as corpus albicans. That means white mass. Well, the luteal phase is now over, and one ovarian cycle is complete. If the fertilization and implantation do occur, then the corpus luteum is not degenerated, but it continues to grow and secrete increasing quantities of progesterone and estrogen. This is important. The cause of corpus luteum involution, that is the loss of feedback inhibition of the pituitary. You should know that how the anterior pituitary gland that is uninhibited, that is by the sudden cessation of the secretion of estrogen and progesterone, and also by the release of inhibin by the corpus luteum. So now the pituitary inhibition, it causes it to begin secreting increasing amounts of FSH and LH. The final involution that occurs at the end of the 12 days of the corpus luteum's life, which makes the 26th day of the cycle, around 2 days before the menstruation. So, what effects this involution brings? First of all, the increasing FSH and LH, they initiate the growth of new follicles. So that marks the beginning of a new ovarian cycle. And secondly, there is a menstruation by the uterus due to the paucity of the progesterone and estrogen secretion.